Have you ever thought about the secrets hiding in plain sight? Tucked away in dusty archives are millions of historical records that hold clues, not just about how people lived, but crucially, how they died. Today, we're going to dive into how researchers are creating a new key to unlock these old secrets and why it's so important for protecting our future.
So, let's just jump right in. The big question is this: how do we look back at the major health crises of the past, from a century ago, and actually learn lessons for today? We've got all this data, but the real question is, are we even reading it the right way?
Well, the most direct sources we have are, of course, death certificates. But here's the catch. The story they tell is often, well, it's murky. It's written in a medical language that's basically become a ghost.
And that brings us to the first huge problem. When you actually look at these old records, the causes of death aren't what they seem. They're like ghosts hiding in the data. I mean, get this. These were all real causes of death written down by doctors 100 years ago. But what in the world is an intestinal cold or senile consumption? These terms are just so vague and outdated that it's incredibly hard for us today to know what disease they were actually talking about. And this ambiguity, it's a massive roadblock.
So how did people deal with this problem for the last century or so? Well, they've been using a standard blueprint, a system that, for its time, was totally revolutionary. But it turns out it has some pretty serious flaws when you're trying to do this kind of historical detective work.
That system is the International Classification of Diseases, or the ICD. For more than 100 years, it's been the global standard. And back in the day, the version they were often using was the fourth revision, or ICD-4. Its whole job was to bring some kind of order to all these medical records.
Now, the key thing to understand about the ICD is its logic. It primarily organizes diseases based on where they are in the body, which organ is sick.
And you can see that logic right here. You've got these groups for the nervous system, the circulatory system, the respiratory system, and so on. Now, this makes perfect sense if you're a doctor treating one patient. But if you're trying to understand how a pandemic ripped through an entire population, you're missing a huge piece of the puzzle: transmission. This system just doesn't care if a lung disease was spread through the air or from a contaminated water pump.
And it's exactly that limitation that sparked a new idea. A group of researchers said, wait a minute, what if we used a completely new lens, a different way of looking at the exact same data to get a much, much clearer picture?
They call it the CCHM, the Classification of Causes of Historical Mortality. So instead of trying to force these old, vague terms into a modern system based on body parts, they built a new one from the ground up, designed specifically for these old records.
And at the heart of it is this powerful idea called the McKeown thesis. It basically argues that to really get why fewer people were dying from infectious diseases over time, you have to focus on how they spread. Was it in the air, in the water? That right there is the key to understanding public health on a massive scale.
So the CCHM starts with this beautifully simple framework. Every single cause of death gets sorted into one of just 3 buckets. Is it infectious, non-infectious, or is it just too poorly defined to tell? Right away, that first step cleans up so much of the data. But here's where it gets really brilliant. Within that infectious category, it sorts diseases by how they're transmitted. And suddenly, you're not just looking at a list of illnesses anymore. You're looking at a map of how they moved through a community. You can literally see the impact of new sewer systems on waterborne diseases or the effect of quarantines on airborne ones. It's a game changer.
So this all sounds great in theory, right? But does it actually work? Well, researchers decided to put the old way and the new way to the test in a head-to-head showdown using real-world data from Spain.
All right, so here's the setup. In one corner, you have the old way, the ICD-4, grouping everything by body part. And in the other corner, you have the new lens, the CCHM, grouping everything by how it spreads. Both of them are trying to make sense of the exact same messy historical records.
The proving ground was 2 towns in southern Spain, and the researchers, they painstakingly went through over 44,000 death records from the first half of the 20th century, coding every single one using both systems. And here's the first mind-blowing result. In the city of Cadiz, when they used the old ICD-4 system, the top 10 causes of death only explained about 56% of all deaths. Think about that. That leaves a massive, almost 44% chunk of mortality just unexplained, scattered across dozens of vague categories.
But now, look what happened when they ran the CCHM on the exact same data. Suddenly, the top 10 causes of death explained almost 75% of all mortality. The picture just became dramatically clearer.
By grouping diseases by how they spread, the major threats to the population just popped right into focus.
The CCHM also showed it had another superpower. It just obliterated the noise in the data. In the smaller town, the old ICD-4 system left them with 106 deaths that were basically cause unknown. They were just too vague to classify. But the CCHM, it slashed that number all the way down to just 18. It basically took the mystery out of the data.
Okay, so this is a really fascinating historical exercise, right? But why should we care about this today? Well, because understanding the past like this is absolutely essential to preparing for the future.
Seriously, think about it. Having a clear, accurate roadmap of how past epidemics, whether it's tuberculosis, cholera, or the flu, actually move through cities gives us an unpriceless blueprint. It can show us which public health measures really worked and which ones didn't, and it helps us model what might happen the next time a new pandemic shows up.
You know, the study's authors really put it best. They said the real strength of the CCHM is its simple but totally profound shift in perspective. By focusing on whether a disease is infectious, and if it is, how it spreads, it becomes this incredibly useful tool for tracking the health of a population over time.
And that really leaves us with a final thought. We are sitting on an absolute treasure trove of data about our own history with infectious disease. If a new way of simply looking at it, of reclassifying it, can reveal such a clearer picture of the past, just imagine what other lessons are still waiting to be found. How much safer could we make our future?